So this is my project over PTSD, also known as post-traumatic stress disorder. So the DSM of PTSD it's classified as the DSM-5 on the Diagnostic and Statistical Manual of Psychiatric Disorders. And this classification of DSM-5, as it's called, would place it in a group of other trauma and stressor-related disorders. And some causes could, as seen by the pictures, a car crash or perhaps abuse, as shown by the middle and the right picture, and these severely have damaging effects on the brain. Okay, so now the etiology or the cause of PTSD would be due to either a single or multiple stressful, frightening, or distressing events. And these experiences can be very traumatizing to the victims as well. Examples could be events such as serious accidents, physical sexual assault, as shown by the two pictures on the right, childhood abuse, domestic abuse, as shown by the bottommost picture, miscarriages of childbirth in women, and serious health problems. The way PTSD functions is that when one has a flashback of his or her traumatizing event in their lifetime, they encounter disturbing thoughts and feelings as an aftermath. And during their aftermath, they often express feelings of sadness, fear, anger, or almost all of them. And along with that, they don't feel as if they have anybody to console in that situation because they don't believe that people around them can share the same, they believe that people around them don't have the same traumatizing experience as they do. Thus, they don't attempt to seek any help. So now we are at the treatment and the prevalence of PTSD. A popular type of therapy is for PTSD is called CBT, or cognitive behavioral therapy. CBT aims to help a victim of PTSD manage their problems by changing how they think or act. Another way is known as group therapy, where all PTSD patients, or a group of them, come together and share their traumas with each other. And this in turn causes them to feel calmed by knowing other people experience their same problems. Now we come to medications, and in particular SSRIs. SSRIs are also called selective serotonin uptake inhibitors, and these are the only medications approved by the FDA for victims of PTSD. Okay, now we come to some statistics. According to the APA, the American Psychology Association, 3.5% of adults have post-traumatic stress disorder. To continue, 1 out of 11 Americans will be diagnosed with PTSD in their lifetime, and women are twice as likely as men to encounter PTSD. So as you can see by the illustrations, there's some medications for PTSD along with group therapy, which is very helpful. And then a bar graph which shows that physical abuse is the most popular way, or is the most common way of causing a PTSD in a victim. Okay, now the prognosis and comorbidity of PTSD. Unfortunately, only 30% of PTSD patients will ever recover from their traumatization. However, more fortunately, 40% of victims will have improved conditions. However, they'll still experience some toned down symptoms of PTSD. Now, when it comes to comorbidity, PTSD is known to exist with other psychiatric disorders and has often been known in the psychological world as a disorder with very high comorbidity, and it shares very many symptoms with other disorders such as depression, substance addiction, and etc. Now onto the history of PTSD. The term post-traumatic stress disorder was widely used in the 1970s, and this was due mainly in part due to the Vietnam War and the diagnosis of the veterans from the war, as they were as they didn't have public support from the war, and they were losing pretty badly in a war that they expected to succeed in. and that caused a very traumatizing experience for the veterans who returned. And then following shortly after the Vietnam War in 1980, the APA labeled PTSD as DSM-3 initially. However, now present day, as I stated earlier, they have updated it to be a category of DSM-5. The very first diagnosis of anything near PTSD would be called rape trauma syndrome. This was brought up by Ann Wilbert Burgess and Linda Holmstrom. And this was a variant of PTSD that they gave to women who had experienced very traumatizing sexual assault. As you can see by the pictures, there's a soldier who isn't in the correct mind, and he's experiencing very troubling thoughts, as perhaps he's not had the best time in the military or has not had support. And now onto my case study. I chose the very famous pop singer Ariana Grande, and this is a little video about her experience with PTSD.
Before we go any further, I want to thank y'all from the bottom of my heart for being here today. I love you so, so much.
Ariana Grande fights back tears during her speech at the One Love Manchester benefit concert on Sunday.
And I want to also say I had the pleasure of meeting Olivia's mommy a few days ago. And as soon as I met her, I started crying, and I gave her a big hug. And she said that I should stop crying because Olivia wouldn't have wanted me to cry. And then she told me that Olivia would have wanted to hear the hits.
Earlier during the show, Ariana performed for the first time since the May 22nd Manchester attack that left 22 dead and more than 100 injured.
Ladies and gentlemen, Ariana Grande!
Proceeds from the concert will benefit the victims and families affected by the bombing.
Okay, now moving on to Ariana Grande's history. Grande was born to a happy couple in Florida who had recently moved there from New York. She grew up in Boca Raton, where at the age of 13 she began performing on Broadway. Then her call to fame is very well known by people our age, as she began starring on Disney Channel's Victorious. And then later on, she would also star in the popular show Sam and Cat on Nickelodeon. Ariana's PTSD came about on May 22nd, 2017, when she had a concert in Manchester, England, where a suicide bomber attended the concert, and after he detonated, his bomb killed 22 people and injured several hundreds more. Unfortunately, Grande said that it was hard to talk about because so many people had suffered from their severe and tremendous loss. But she said her PTSD was affecting her, and it was a very real thing. In my mind, she probably gained PTSD after having recollections about that fateful day, where she unfortunately had to witness many of her beloved fans getting injured and wounded, and even killed from the attack. She, in her mind, she probably believes that she shouldn't have gone through with the concert and probably has many setbacks, and she mourns the loss of her many supporters. As you can see by the scenes in the pictures, it shows Grande in the Instagram post at the bottom, hanging out with a fan, perhaps talking about the attack, and perhaps just sharing some love with her fans. And then the two pictures on the right show the catastrophe at the arena in Manchester, England. Now, as for her diagnosis, in order to diagnose Ariana Grande, I'd have to check her for symptoms, and she has reported that she has been experiencing a syndrome where she re-experiences a flashback occasionally about that fateful day. Due to this re-experiencing syndrome, that would be enough for me to diagnose her as someone who exhibits PTSD. In order to aid her, I'd encourage her to meet with many fans of hers and supporters who were at her concert, as this can be considered as group therapy, and this way she can interact with other people who have shared trauma. This would create a sense of union between her fans and her, which would be very tough to break. And this way, they can break out of their previous miserable selves. Instead of just recollecting that memory, they instead think that they were together and they survived and they're strong. If this route wouldn't work, I'd resort to prescribing Ariana Grande with SSRIs. And thank you for listening to my presentation.